To illustrate the intersection of tech and health, we have a visionary who bridges both worlds, a healer with a doctor's heart and a coder's mind, Dr. Kayode Odunuga. A medical doctor and a digital health innovator is the brain behind Cancer Quest, an AI game that interactively teaches Nigerian youth to combat virtual cancer cells and gain essential health knowledge. Dr. Odunuga will share insights on its creation and the health technology intersection. Dr. Odunuga, thank you for joining us on TechnyFire.
So thank you very much for this opportunity.
Amazing, amazing. Let's get to know you better. You're a medical doctor?
Yes.
What field are you basically?
Okay, currently I'm a digital health innovator and also into public health.
Okay, and public health,
Yeah.
generally, what do you mean by public health?
Okay, public health is a branch of medicine that deals basically with disease communication, health education, health awareness.
Okay, you've been a doctor for how long?
So I've been a doctor, I graduated in 2021.
Okay.
So I've been a doctor for over 4 years now.
So how come? How did you move? How did you get into tech?
Okay, so after medical school and during the course of medical school, I observed that there were solutions or there were problems I saw that I wanted technology to be the solution for that. So after medical school, I learned software development. So I later got into artificial intelligence and I'm currently in generative AI.
Artificial intelligence?
Yes, sir.
Generative AI.
Yeah.
So you've been through a lot. Let's talk about the intersection between algorithm and anatomy.
Yeah.
We're talking about health tech and tech health. You know what I mean? There are two differences
Yeah.
here. The health of technology and the technology of health.
Yeah.
Can you explain further?
Okay, I would say health tech is the intersection between health and technology. And I would say that it has come to be the solution to major health problems which we have right now. And I'll say the technology of health has to do whereby it will focus much on the users, whereby we are caring for the health care of the users in terms of, say, for example, programmers. We have to talk about their mental health well-being, and we have to talk about learning how to digitally detox certain times. And we have to also talk about the users of the applications in terms of having long-time screening times, which are affecting their eyes. So that's the technology of health. While the health tech has to do with digital innovations that are solving real problems right now. Talking about telemedicine, talking about data analytics, talking about the use of artificial intelligence and precision medicine.
So apparently that means the devices in our pockets and the devices in our homes are changing our lives, isn't it?
Yes, yes. They're going a long way. Let's give, currently you have a smartwatch. You know, your smartwatch knows you very much well.
Yes.
And it knows your blood pressure readings, talking about your pulse rate, and those help to create analytics for even the doctor when he makes his diagnosis. And it give you reminders about, let's say you have alerts for certain medications you should take.
So that means AI is taking over, right? Is that not AI in practice?
Yes, and to me, I describe AI as my best friend right now. AI is yes, it has its downsides, but the fact is that it's here to make things easy, and it's here to give possibilities, and it's here to make things quite easier for the doctor and also for the patients.
Talking about the positive sides, can you mention like 3 or 4?
Okay, I would say a major area is precision medicine, whereby we could get diagnosis and get the right solution for such diagnosis. And another great area is in the area of using machine learning to make predictions, where we are predicting patients who are diabetic or who are not diabetic. A good area is a generative AI, and I love generative AI. It's showing that there are possibilities that we have not yet explored in the medical space.
So on the flip side, what are the challenges we're going to face with this? Because some people are talking about over-reliance on these, like some people, the beep, just a beep on their phone, on their watches gives them a surge in their feeling that, wow, that's my health telling me something else again. Is that not a problem?
Okay, I won't say it's a problem. Let's give a practical example. Now, your phone dings and you get an alert. You know, there's a feeling it gives you. That's the same thing. It's not going to be an over-reliance. It's going to be a big check for keeping your health. And a major thing in, for example, take the Nigerian healthcare system is the infrastructure. Are there sustainable infrastructure to accommodate AI? A good thing is that we don't have an ethical framework for the use of artificial intelligence in the healthcare sector. We don't even have a data storage for healthcare data. And we have, yes, there's a transition whereby we have so many hospitals who are using electronic health records, but are they efficiently available right now in terms of all hospitals using it?
Okay. Are they available for everybody, really? When we talk about these health tech, are they going to be available for even the downtrodden?
Yes. It's going to make it quite easy. They are available. We're talking about like chatbots, chatbot for telemedicine. They are available, but in terms of the cost, you have to pay for it. And the truth is, those chatbot gives you health education tips, and they are very available. But certain areas whereby they are non-network services, there can be restrictions in those
challenges
yes.
there. And again, where does the data? Where do they go? Like, you know, nowadays, even if I'm diabetic, that it used to be between me and my doctor. But nowadays, if I'm diabetic or if I have health issues, it goes into my watch, and my watch, the data goes somewhere. What does it go to? My employers or my employer or anybody that don't want them to see or to know about my health issues, can they get access to this data later?
Okay, now, let's take, for example, your smartwatch. The data from your smartwatch goes to the data bank. And let's say the data bank is connected to an electronic health record whereby your doctor can have access to. That means that it's between you and your doctor. Now, there's ethics behind that whereby there's confidentiality, whereby that data cannot be shared with an employee, with a third party.
Hopefully.
Yes.
Hopefully. I have to stress that again. Because of time, let's quickly come to your creation now, because we're discussing about the Cancer Quest. Is that the creation you have?
Yes, sir.
And I think you said it comes in different languages, Nigerian languages, and it makes the youth to be aware of cancer. Tell us more about it.
Okay, Cancer Quest is an AI gaming platform in telemedicine for cancer education and awareness. So it has an inbuilt feature for Yoruba, Hausa, and Igbo. There's an inbuilt feature of natural language processing, and it focuses on 6 major cancers. Basically, the game zones are for breast cancer, which we call the breast burrow, for lung cancer, which we call lung glands, for cervical cancer, which we call cervical kingdom. We have prostatia for prostate cancer, hope hills for childhood cancer, and now each and every one of these games, there's a personalized learning whereby the player learns about cancer in a very educative and entertaining way, and also he can play games that can be educative. And these games, there's a leaderboard where you know who is topping the leader chart, and there's also an inbuilt telemedicine platform where you could book a test or you could book a consultation from the doctor.
And you built, and I have to stress it, you built all these by yourself?
Yes, with the help of artificial intelligence.
You did the website, everything by yourself?
Yeah.
Wow, that's amazing. So what time do you have to mix all these together?
Okay.
Medicine and tech?
Okay, so currently I'm into digital health and I work remotely, so I give me much time, and there's a lot of flexibility than working in the hospital and a clinical setting. Okay. So there's much time and much flexibility, and there are opportunities to think, and there are opportunities to go out to meet people who stir your mind to think.
All right, then. Thank you so much, Dr. Kayode Odunuga.
Yes, sir.
Thank you. I hope to have more of you around.
Yes, sir.
Thank you. That's all we can take from Dr. Kayode Odunuga, talking about health tech and tech of health.